Hi, Opal. Welcome to the show.
Hi, Mike. Thanks for having me.
How's sunny Victoria right now, or is it not sunny?
Well, we've had overcast for a little while, but I know I shouldn't say that too loudly because sometimes it's not the best received. But we get some peaks of the sun coming in and out.
Oh, that's nice. We're just starting to have our leaves come out here in Newfoundland. We're a few months behind you guys, but we're getting there slowly. But I really appreciate you joining me today. You work with the Heart and Stroke Foundation. You're a registered nurse. Can you give us a bit of a background on your organization and a bit of history there?
Yes. So Heart and Stroke is Canada's biggest health charity. So we lead the fight against heart disease and stroke. We actually started in 1952 and are celebrating our 70th anniversary this year. So very excited for that.
That's cool.
Some of the work that we've done has been investing into life-saving research. So over the years, we've invested 1.6 billion into different research areas, and some of those kind of like key treatment and research breakthroughs include the first successful open heart surgery, heart transplant, discovery of ACE inhibitors, which is a medication that significantly reduces the risk of heart attacks and strokes. We established the Canadian Stroke Best Practice Recommendations and had funded research that discovered a better way to detect atrial fibrillation.
Wow. Yeah. Those are all major health conditions that I've even heard of. And we're talking about those today as well. We're going to talk to some experts about some people that actually have these different conditions, but we're going to talk mostly about what your organization does today. And so your goals are to focus on prevention, right? And is it saving lives and then also transforming recovery? Is that the key pillars?
Yeah, enhancing recovery. Yeah,
Mm-hmm.
so promoting health, saving lives, and enhancing recovery.
Okay, well, let's talk about each one of these and break them down because I'm sure you could talk like all day on each one of those topics. So tell me, in terms of like prevention side, like are people more susceptible to heart disease than others? Like I read data that show that there's strokes among young people are on the rise. Like how much of an impact do we have on age? What's happening to their lifestyle? Like give me the lowdown on that.
There are some risk factors that would put a person at a higher risk for heart disease or stroke than others. So we can kind of start there. An example being blood pressure. So high blood pressure is actually the number one cause of stroke and most heart diseases. Most people don't even know that they have high blood pressure or hypertension until they have an event. It's so important to know your blood pressure. I'm sure we'll get into that a little bit later too. But other risk factors are conditions like diabetes, or genetic predispositions that you might have. And then, of course, lifestyle. So looking at being smoke-free, physically active, and eating a healthy and balanced diet are all things that will significantly reduce your risk of heart disease and stroke. And then to your earlier point as well, just about how we're seeing some data that shows that strokes among young people are on the rise. You're absolutely correct. We are seeing that. We think this is due to people living a less active lifestyle. So spending more time in front of their screens, they're working harder, longer. They're not taking the opportunities to get out and be active. We know that people are experiencing a lot of financial stress pressures right now that can limit your access to healthy foods. Again, leading to an increased risk of things like diabetes or high blood pressure, and really just generally poor healthcare overall. So we are seeing that some of these conditions are showing up almost 10 years earlier than they would have in the past.
Wow, that seems extremely significant when you think about something like a stroke, which is a major event. So are we going to be seeing this changing over time? Do you think that we're going to end up increasing education to be able to make these things more known? Because I don't know if people really realize that at a younger age, they're more susceptible to stroke.
Absolutely. Heart and Stroke works towards increasing awareness all the time. And a key component of that is through things like education and access to health information to try and give Canadians the tools that they need to live their healthiest and best lives and reduce their risk. So it absolutely starts with education and prevention.
Yeah, that's why it's so good to have somebody like yourself on here today to be able to talk about this. And there's one thing I think that people are starting to become more aware of, and that is that women are more disproportionately affected by stroke. Is that true?
Yes, it is. Actually, 1/3 more women die of stroke than men. And women generally have worse outcomes after a stroke too. So we know that they're 60% less likely to regain their independence. They have like fewer functional gains after a stroke, which can ultimately lead to a worse quality of life.
Well, maybe you can just give a quick lowdown on what happens when somebody has a stroke for people that are listening that might not actually understand that context.
Yes. So the signs of a stroke, we say it's fast. So FAST. Face, is it drooping? Arms, can you raise both of them? Speech, is it slurred or jumbled? And if you're experiencing any of those, T for time, to call 911 right away. There are some additional signs that you can have too, that being vision distortion, you can have balance problems, or a sudden onset severe headache. Those on their own most likely may not indicate stroke, but if they're combined, they're also worrisome. So those first kind of 4 fast signs are the easiest to remember and so important to call 911 and not to drive yourself to the hospital.
Right.
Our emergency medical systems know which hospital to take you to, and that's why we want you to activate that system and call 911.
Yeah, and that's critically important. I mean, and one of the things is, trying to avoid ever being put in that life or death type situation with a stroke. Like you guys said that you educate as well. What are some ways that you guys promote prevention?
We do a lot of work influencing health public policy. So we work closely and in collaboration with Health Canada, the Canada Food Guide, and we provide education and health information to healthcare professionals and the general public. So some of our advocacy work has resulted in legislative and policy changes, both at the federal and provincial levels. So this work focuses on protecting youth from damages caused by vaping, which we know that can then lead to a higher risk factor later on in life. We can work to convince governments to protect kids' health through nutrition planning that includes restrictive marketing of foods and beverages to children. That's so important. And just generally advocating for a healthier food supply. So some of this is done through tougher laws on sugar labeling and salt content. We also teach CPR and advanced cardiac life support to healthcare professionals. And again, we created the stroke best practice recommendations. We work closely with provincial health systems to put that evidence-based practices into place.
Well, it's true. I think everybody's heard of the Heart and Stroke Foundation, so it's interesting for us to find out a little bit more about what they do. So we've talked about this. Now we're getting sort of into saving lives side of things. You just mentioned CPR. We talked about stroke, but heart attack's different than stroke, right? So
absolutely.
Are the signs for that different than a stroke?
Yes. So the most common signs for a heart attack are going to include chest or upper body discomfort, shortness of breath, sweating, nausea, or lightheadedness. So those are all signs that you might be experiencing a heart attack. Again, if you are feeling any of those and you're concerned along with that, you call 911. Do not drive yourself to the hospital.
Right. And, and I guess, is there a difference between males and females and how they experience a heart attack?
There is, and it is considerable, and it's absolutely worth mentioning.
Okay.
So with women, what we're seeing is that women don't typically experience that distinct or sudden chest pain that you might see or hear about or know about, but often it's described as more of a diffuse pressure or pain, sometimes across the lower chest, upper abdomen, and can be often referred to as even indigestion sometimes. So not typically presenting itself with that kind of sudden acute pain. Women are also more likely to experience pain in their back, sometimes instead of in their chest. And then sometimes having a stronger feeling of that dizziness or lightheadedness and fatigue than we might see in a male presenting with a heart attack.
And so when it comes to the guidelines, you're obviously speaking from experience as a registered nurse, but also somebody from the Heart and Stroke Foundation. You guys have helped improve some of this emergency response you mentioned. Like, what does that actually mean? And what have you guys been able to do to sort of improve the quality of care?
Yeah, again, kind of going back to that provincial and municipal government. So working to influence the adoption and legislation of increasing CPR uptake. So having CPR being taught in schools, AED placements in public spaces, linking the provincial AED registry to the 911 dispatch, and then supporting quality improvement just overall in the emergency response system.
Cool. Excellent. And CPR courses, you guys offer those across the country? So here in St. John's and all around Newfoundland and Labrador as well?
Yes, absolutely. We have an essential CPR and AED course called Heart Saver. And you're absolutely right, it's open to everyone. To find a course that is near you, whether you're in Victoria or St. John's, you can just visit heartandstroke.ca.
Oh, that's good to know. That's great because, yeah, it's something that people need to do regularly to remind themselves and to get updated. Things are changing with that. I'm still CPR certified. I think I've been certified since I was like 16 years old, which I'm happy I have that skill set. I hope I never have to use it, but it's good to have, and a lot of people need to do it for work. Now, let's sort of scoot into this last pillar we have here, this transforming recovery. What services are available to patients and their families that are recovering from heart failure or stroke or some sort of condition? Because it's already happened. Now they need some help.
Heart and Stroke's website, so heartandstroke.ca, lists a ton of resources offering information on heart failure specifically, if that's a condition that you've had experience with, but also on lots of different heart diseases and on stroke. This can be helpful for somebody who's living with that condition, or if you're a family member or caregiver of somebody who has any of those conditions. You can visit heartandstroke.ca. We also have online peer support communities. So we know that mental health is challenging right now for everyone, and people living with heart diseases or having experienced a stroke can, feel the impact of mental health challenges even more so. Peer support is one great way that we can combat some of those mental health challenges. And if you visit heartandstroke.ca/connect, you can find peer support communities for somebody who might be living with a condition, or if you're a caregiver and looking for that peer support, there's a community for you there too.
That's excellent. And how well is the system that we currently have? And I'm sure it's different provincially, because there's obviously provincial healthcare systems and there's national, but how is it working? And where do you see the areas for improvement, or what recommendations are being made to sort of take it to the next level?
Well, we know that the geography of Canada can make it challenging to access services in the healthcare system. We know that that can be true even if you're living in an urban center, though, too. So even if you happen to be in a larger city in Canada, there's still challenges that you can come across in accessing the right care at the right time. So speaking to heart failure specifically, Heart and Stroke has teamed up with a bunch of national leaders in the heart failure space to tackle equity and access. We know that right now there's a lot of people living in Canada with heart failure that don't have access to the care that they need at the time that they need it. So we're working in quite a collaborative way to try to highlight where those gaps are and then solution them at the provincial level as we move through this action plan.
That's good. And that's good. It's nice. It's funny. COVID has changed a lot of things. It's probably changed the delivery model of what you did. But that delivery model could now be probably online and in person, and how we do work is changing. So I would maybe you get a quick second here to go back through some of those online resources for people that are listening and they're like, this is relevant to me. Where can they go find that information again?
Yes. So online for health information or for education resources, heartandstroke.ca has a resources and services section. So you can go there, drop down menu, and find which health condition or which, heart condition, or if it's stroke that you're looking for, there's a ton of different resources there. And then if you're looking for peer support, we offer online peer support communities. So what you were saying, you can speak to somebody who's in Newfoundland and you might be from Victoria, and learn from each other and share your experiences and work together to get through it.
Yeah, exactly. I mean, peer support was something we used to use. I used to work on the offshore, and sometimes you only had the person next to you to be able to help you. And peer support was such a valuable tool for people that are coping with challenging things. And this would obviously be one of them. Are there any last thoughts you want to leave our listeners with? It's a wellness show. We always like to hear from the experts as we close up an interview.
Yes, take the time to find out about your personal risk. Don't think that this doesn't apply to you. Be aware of the signs of an emergency, such as heart attack or stroke that we talked about today. And I know I've said this a few times, but if you do find yourself in a situation where you or someone else is experiencing a sign of an emergency, like heart attack or stroke, call 911. Don't drive yourself to the hospital.
Well, that's good advice. And I hope anybody listening who has to ever apply something like that does it that way, because I know that there's a window of time that makes recovery a lot better the sooner you get treatment. So that's great advice. Thank you so much for joining me today.
Thank you so much for having me. It's been a pleasure.
Hi, Rodolfo. Welcome to the show.
Thank you. Thanks for having me.
Oh, it's nice to have you. You're an expert in this area. And today we're talking all about heart health. Now, you've had a number of roles in a 20 plus year career, but today we want to talk about your role as a nurse practitioner at the heart function clinic at Eastern Health. Tell us a bit about your clinic and what your role is there.
So I've been a nurse practitioner since about 2011, and since that time I've been fully ingrained into the heart function clinic, which was initially developed back in 2007 here in Eastern Health. The whole premise behind the heart function clinic was to address a very specific patient population within the cardiac world, was the patients who were diagnosed with congestive heart failure or some impairment of their heart function. They get referred at this point in time by cardiologists who have seen the patient, have deemed them of having a working diagnosis of congestive heart failure, and refer them to our clinic for further management. What that management looks like is we see the patient that has the accurate diagnosis of heart failure, and then we use all the conventional goal-directed medical therapies that are currently available to see if we can improve on their outcomes in terms of mortality, improving their heart function status, and of course, improving their quality of life.
So you're no stranger to educating people. You've spoken on this topic nationally around the province, and can you explain what heart failure is in layman's terms?
Yeah, so a great question, actually. So heart failure is when the heart doesn't have the ability to pump blood efficiently around the body, and it's usually a result of the heart being too weak or too stiff or a combination of both. So when that happens, the heart is not able to get the blood supply out to the other vital organs and or to the rest of the body to allow you to carry out daily activities of daily living, such as getting up, walking, doing exercise, just carrying out routine daily activities. And it often presents with patients experiencing what we call dyspnea or shortness of breath and or tiredness and feeling fatigued.
That's interesting. So just, for everybody listening that might not understand how the cardiovascular system works, I mean, our heart never really stops beating, right? And when it's shuttling blood around our body, it brings other nutrients. Like you just said, shortness of breath. Like, why would that be something that occurs when we have a heart that's not working as well as it should?
And so it's the body's response to the impaired left ventricle. So picture it, if you will, that's the powerhouse of the body. So every time that pumps blood, it's got to pump blood right from the top of your head all the way down to your feet. So when the heart is not pumping at its maximum capacity or the capacity that's needed to carry out all of our activities of daily living, then the heart sort of sends or the heart actually responds by increasing our depth of respiration. So we breathe harder, breathe faster, thinking that we need to do that. But in actual, it's not a lung problem. It's the heart not being able to get the blood to where it needs to go. And it's seeing it as being deficient in oxygen.
Wow. Yeah. So that's a few things. What other things, like does the body respond to when it's going through heart failure? Is like we get shortness of breath now, you said, activities of daily living. What else can happen to us?
Fatigue is another big hallmark, and that's two of the most popular questions we ask when patients come to clinic is about their shortness of breath and about tiredness. How do you feel on a daily basis? You get up, you do your morning routine. Do you have to go back then and lie down? Are you becoming overwhelmed, fatigued, tired that you have to go sit down because you need that rest because your heart or your body is not able to keep up with the activities that you're currently doing?
That's right. Okay, so somebody's starting to experience these symptoms. Do these get worse over time? Do they progress as somebody's heart failure gets worse?
Absolutely, and that's one of the things that often leads patients to seek out medical attention, that over the course of time, their symptoms progress. So what they experience is mild shortness of breath or mild tiredness. Sometimes we chalk it up to just getting older as we age and we're not able to do what we did a few years prior. But eventually sometimes it can be even a short course of time, they get quite symptomatic, and by that, they fall asleep after they get up to carry out activities, have to sit down. They're no longer able to do things progressively. And also they become quite short of breath with minimal activity. So for example, take yourself and I trying to walk up a set of stairs. We can generally do it pretty freely. If we climb 4 sets, we might get a little bit short of breath when we get to the top. But for those patients, as it progresses, as you start going upstairs, sometimes you have to stop mid-stairs or stop when you get to the top, hold on to the handrail and just catch your breath and take a breather, and to sort of recoup some of that energy before you can carry on with what it is, wherever you want to go.
Okay, so that sounds like a relatively alarming diagnosis for a lot of people. Can heart failure be reduced or reversed in certain cases?
Actually, once you get diagnosed with heart failure, it's a diagnosis that you always have. And for the most part, it is a progressive disease. But with the current therapies that we use, so the goal-directed medical therapies that are research-based, we call it 4 pillars of heart failure care or management. And if we can get those 4 medications in place for people with heart failure where the heart function is weak, then we can actually see patients' symptoms improve so that they improve their quality of life, their mortality improves, their reduction in hospitalizations improve. So we don't call it a cure, we call it heart failure that has improved, or the heart function has improved, but it's not a curable disease.
Okay, well, that makes sense. So, obviously people that are experiencing a condition like this need to have expert advice because it's quite serious, of course. How does somebody get referred to a clinic such as yours, and particularly your clinic?
Yeah, so right now, actually, it's generally cardiology referral based. So it's somebody who's had a presentation either to the emergency department or an admission to hospital where the initial or preliminary workup has been done and they haven't established a working diagnosis of congestive heart failure. So once that's sort of set in motion, they are started on some of the therapies, and then they get referred to our clinic. That's when we take over a bigger role in the patient care and management in terms of establishing that the patients are on all the right therapies. They continue to get the up titration of the medications that's needed to improve that heart function. And we follow them for about 6 to 9 months to get the medications titrated. So we wouldn't see you on a one-time basis. We get you to clinic, start you on your therapies. We keep up titrating over a period of about 3 to 4 months, then get your heart function reevaluated to see if things have improved. And then based on that result, we would plan as to what the next steps would be in your management.
Yeah, and for those people listening, titrating is just modifying the medications as you see the benefit or not as much benefit as you think. You just always got to tweak it. It's a sort of imperfect science sometimes, isn't it? But you can fix it over time when you pay attention to it, right?
Absolutely, and by tweaking the medications, it's not solely based on your symptomatic response. Of course, we always want that, and we want you to improve your symptoms. We want things to improve and you get back to a better quality of life, being more active in your lifestyle. But all of those medications have been tested and tried in large-scale clinical trials and have shown to have the benefit of making you live longer, improving your heart function, and keeping you at a hospital. So our whole goal is to try to get you on all maximum goal-directed medical therapy. So getting you on the maximum dose that's recommended. Not all patients are going to tolerate it. So we sometimes say it's the maximum tolerable dose, but it's actually trying to get you on all the therapy so that we can get the best outcome for you and, of course, your family members.
Yeah, that's amazing. And I also think that, that heart failure must also affect anybody, no matter where they live. And so I think about Newfoundland having a large rural population. How do you guys support people that might not necessarily be in a hub that would have resources like this?
Yeah, so that's again a very good question, and an actual initiative that we are currently looking at within the province is developing a provincial heart failure strategy. We know that all services can't be the same depending on where you live, but how is it that we can actually reach out to those remote areas and provide the best possible heart failure care so that, you know, irrespective of your geographic location, you still get the best management. So I think that's going to come down to multi levels of primary care providers, specialist care in varying geographic regions of the province, all coming together to get the best outcomes. So who can see the patient to provide the best medications to get the best outcome for the heart failure care. And I think that's going to come with continued education, with support from larger centers in terms of being able to help support those geographic areas, whether that be through virtual care. So using things like remote patient monitoring systems, using virtual care by way of, as we used during COVID, actually, where we actually looked at our patients through the use of iPads and being able to see face-to-face remote visits and provide triggered questions to see how the person's doing. Are they getting worsening of their symptoms and improvement of their symptoms? And based on their hemodynamics or parameters they provide at home, for example, taking their daily weights, taking their blood pressure, taking their heart rate, were we able to actually increase their medications to actually goal-directed medical therapies to improve heart function from afar.
That's amazing. And I think, you know, the pandemic was not a great time. However, when it came to remote medicine, it was kind of a critical time for us to step change into seeing that, yeah, we can deliver a lot of these things remotely. When you look back at these programs that are being offered, you know, locally and nationally, are there any gaps that you guys are trying to address as you reevaluate things? I know the province is really looking at healthcare and finding the most efficient ways to deliver it. What are you guys seeing for that?
Yeah, absolutely. And there are, you know, gaps within care, whether it be at a local level, provincial level, and or nationally. And I'm very fortunate actually to be able to work with Heart and Stroke nationally and developing a national heart failure action plan that we've been sort of sitting around the table for the last year, strategizing and identifying what these gaps are. And of course, it's, you know, whether it could be specialized populations, whether it could be remoteness, whether it could be a lack of virtual care, inability of virtual care to be able to be performed in some remote areas because of lack of access to the internet, for example. So from a national perspective, and through Heart and Stroke, we're looking at how is it that we can best identify these gaps. How is it that we can close those gaps and put an action plan into place, you know, from a more global national perspective, and how that can address those gaps in care for our patients throughout the country.
Yeah, and I'm sure there's a lot you can contribute to the rest of the country, given our geographic challenges and a broad population over Newfoundland and Labrador. Any last thoughts you want to leave the listeners with when it comes to being cognizant of this being a risk factor for many people?
Yeah, one is know your body and know how your body responds and how it's changing. Don't just assume that you're getting more short of breath walking up the hill to go berry picking and or trouting, that it's because you're getting older. It could be that there could be something going on with your heart. As you get more and more prolonged in the diagnosis of impaired heart function, you're going to notice things like swelling in your legs. So be aware that if things are starting to add up, you know, I'm more tired, I'm more short of breath, and I now am starting to have swelling in both my legs, then this could be a symptom or symptoms of a bigger problem that's about to come, about to happen. And generally, it's late in the diagnosis, before patients actually reach out to their healthcare provider. And sometimes it can be a matter of going back and forth to healthcare providers or to the emergency department on a number of visits before we actually get them diagnosed with heart failure. Also look at your risk factors. Do you have high blood pressure? Is that well controlled? Am I a diabetic? Is that well controlled? So do I have other things that are going on, such as other cardiac issues that may actually be contributing or can contribute to the diagnosis of heart failure? The big thing that we want to focus on is getting diagnosed early, getting access to appropriate care, and getting put on those goal-directed medical therapies to actually improve the heart function overall with time. And generally, we'll only know that if we get repeat testing in terms of another ultrasound of your heart so that we can identify if that number has gone up.
That's excellent. Well, and also having experts like yourself on today sharing this important information for people will give people those ideas around, oh, maybe I should go get checked. So thank you so much for taking the time and joining us today.
Thank you for having me.
Hi, Linda. Welcome to the show.
Hi, how are you?
I'm fantastic. How are you doing?
I'm not doing too bad.
That's great. How's the weather in Central right now?
Not too bad, not too bad. It could be warmer, but it's still warmer than St. John's.
And well, everywhere is warmer than the Avalon. You guys are fortunate. As soon as we pass that isthmus, we're all set. So you live in Gambo right now, and you're joining us tonight because you actually are an individual who's living with heart failure. And based on the name, you'd think, how can somebody live with heart failure? But can you tell us a little bit about the condition, how you're diagnosed in your story?
Yes. Okay, my condition is I have dilated cardiomyopathy, and I have LBBB, which stands for left bundle branch block. In dilated cardiomyopathy, the heart is enlarged and it doesn't pump properly. In the left bundle branch block, the left ventricle is delayed, and it causes the right ventricle to pump later than the left. They should be pumping in sync to push the blood out into the body, but mine pumps in different intervals.
Right. Okay. So how were you diagnosed with this condition? Did you start to feel different one day?
That's a long story. In April of 2006, I started feeling very fatigued and very short of breath. And just being after the winter, I thought, okay, maybe I'm out of shape. So my husband and I always walk in the spring. So we started walking, and I couldn't do our walk. I was so short of breath. And this continued. And unfortunately, I'll just add this in there, and you can do what you like with it. But my family doctor had coincidentally gone on leave at the same time that this happened to me. So I spent 4, if not 5 months going back and forth to walk-in clinic and emergency because I was so short of breath. My heart was racing. I could count my heartbeat in my head. It was racing so much. And I went to emergencies in Central. I went to emergency here in St. John's. And one doctor in emergency in Central told me I was 50 at the time. I was too young to have a heart condition. Here in St. John's, I went in there at emergency with a resting heart rate of 148. The nurses thought they were going to move me to another bed. I'm thinking heart monitor. The doctor came in and said, no, he was going to pump 2 liters of fluid in me, which he did and sent me home. Not knowing, and I didn't know, I was in congestive heart failure already, which meant too much fluid around my heart. So I went home that day and I became so violently ill, I thought I was going to die. As it happened, after about 4 months, being treated for bronchitis, I might add, that's what they told me I had, my family doctor came back, and I, by the grace of God, had an appointment that very first morning she was back. When she saw me, she became alarmed because I've had illness over the past years, and she knows me well. So she picked up the phone at her clinic and called the internist at our hospital. And I got an appointment to see him the next day. My resting heart rate there was 168. He admitted me immediately, wouldn't even let me go home to get anything. The next day, I was given an echocardiogram. When I got back to my room, he was there waiting for me, and I was diagnosed with congestive heart failure.
Wow.
And so then it started a fairly long journey. I was put on medication. I would sweat so profusely that I went to see my family doctor one night, and I had just been at the store and tried on a pair of jeans. She thought I had gotten out of the shower and came to see her without drying my hair.
Wow.
That's how much I was sweating.
I mean, people have to understand here, if you're having a heart rate of 140 beats per minute, that's like the high level of exercise for an individual. Almost 80% of their target heart rate for, like, this would be running the Tele 10 all day long, nonstop. So no wonder you were fatigued. No wonder you were feeling off. And I'm just really glad that you were able to get this. And that's what the value of having somebody that knows your health. You know, what's happened since then? So you've been treated, you're obviously controlled now. What does it mean
Yes.
living with heart failure now? How's that changed your life?
It changed it dramatically. After I was diagnosed, I waited about 6 weeks, I would think, to get into St. John's for a cardiac cath. By the time I got in here, my ejection fraction was down to 18. Now, a normal ejection fraction is in the 60s. So I was pretty sick. But fortunately at that time, that was 17 years ago, fortunately at that time, they got me on medications and whatnot, and I became reasonably well. And I was stupid enough at the time to think that now I'm feeling well, I'm better, even though they told me there was no cure. But you tend to think when you feel well, you can do anything. So living with heart failure for me means that I have changed my life dramatically over the past 4 or 5 years, when I had a second episode that was much worse. And it means that you rest when you think you don't need to. You change your diet completely. Salt is a thing that doesn't exist in my house anymore. But having said that, when the doctor told me I was in congestive heart failure, my first question to him was, am I dying at 50 years old?
Right.
17 years later, I'm still around.
Mm-hmm.
So it's been a learning process, and it's been a process that my daughter is a registered Bachelor of Nursing, and she would always say to me, Mom, you're doing too much. But Mom knew better. She wasn't doing too much until I finally really did too much too long, and I paid the price for it. So it just means having to watch your life daily, having to give up some things that were always normal. But life is good.
Yeah, right. Exactly. So, I mean, you must have learned a tremendous amount about just overall health, because the same things that seem to help your condition are things that make people healthier in general. So what were some of the big, like, light bulbs that went off for you, like, on your journey of education?
On my journey of education, I think listening to my body was a big factor, because we ignore our bodies a lot. However, I've had quite a lot of experience with doctors and with medical. I had my back broken at one time in a car accident, so it's not unknown to me. But I sort of thought when I got over that episode of not being able to breathe, of almost passing out, when I felt normal, I thought I was normal. So my education has sort of gotten to the fact that even if I don't feel tired, extremely tired, like my doctor keeps saying to me, you need to rest at least 2 hours a day.
Right.
And that's something that was hard for me to do, but I do it now. Getting used to living with no salt in my diet, only what's there. And eating out now, it seems like I'm eating in a salt factory all the time, but I do it occasionally. However, walking is really good for your heart as well. And I know that by education. However, I have severe back problems and I can't walk very much at all. So it's coping with all those issues and coping with everything. But the education of it, what was the most important thing for me was advocating for myself.
I agree with that 1000%. But you know what? You can advocate for yourself when you know your body and you know there's something wrong and you see things changing because you have an idea behind it. That's, to me, is the huge part of it. Like when people are trying to seek healthcare, because I'm sure you've got to constantly have some level of support just in case something changes. How did the pandemic impact that for you in your experience?
I have had tremendous support from my cardiac team, my internist, and my family doctor. However, COVID impacted it dramatically at the beginning because in January of 2020, I had an implant done. It's called a CRT-D. It's a pacemaker defibrillator implanted in my heart. And you normally see your cardio-electrophysiologist 3 to 6 months after that. Because of COVID, I didn't get seen for almost a year. I had talked to the pacemaker clinic, and I have a remote device, but I didn't know how my heart was reacting, only by how I felt, and I didn't feel good. But so when I look at the healthcare system crisis today, my help from my cardiac team was tremendous. But like I said, COVID did sort of mess it up for the first few months. But support, I have tremendous family support. My friends are supportive. I couldn't ask for much more support than I get. And I have found over the past few years on social media, there are cardiac groups. And I belong to one that's called Canadian Women with Medical Heart Issues. And I belong to one on the Heart and Stroke Foundation. And believe you me, you can learn a lot from that, an awful lot, because women present so differently from men with heart conditions.
Oh, that's good to know. And that's interesting for anybody who's listening. Then, you can find these advocacy sites out there. Did you have any benefit of remote monitoring at all during the time when you couldn't see your physicians?
Yes, I have a remote monitor at home. And the monitor reports, it takes my readings daily. If there's something that goes out of whack, it reports it to the pacemaker clinic. Other than that, they check it every 3 months. But just a little over a year ago, I was feeling fine. And all of a sudden, I felt like I'm going to pass out. It happened that quickly. My husband was in the same room with me. I didn't even have time to tell him how I felt before I passed out.
Wow.
So when I came to, I was extremely fatigued, very weak. I didn't know what was happening. Shortly after, I had a call from the pacemaker clinic. And because of my remote monitor, they told me that my heart rate had gone for up to over 200. They didn't tell me the exact pulse rate, but it was over 200 for a span of about 30 seconds. Wow. And my defibrillator cut in and shocked me and brought me back to normal rhythm. Wow. So thanks for the CRT-D, which is the name of my machine. I'm alive today. I was told by 3 doctors the next day that we might not be having this conversation if I never had the defibrillator.
That's unbelievable. Well, I'm glad we're having this conversation today. It's so enlightening. I guess a question, as we start to wind down here would be like, what do you wish you knew about this beforehand? Like, were you shocked? Were you was it genetic? Like, what didn't you know about this that you would have loved to have known?
I knew nothing about cardiomyopathy. Didn't even know it existed. And even when I was having so much trouble breathing, My heart never came to my mind once. I thought there was something wrong with my lungs, and they were treating me for bronchitis. I left a walk-in clinic one day. The doctor had given me a puffer, and I threw it in the garbage on the way out because I had been given so many. I knew it wasn't working. When I look back on it, I was 50 years old. And if there's someone reasonably healthy and they're feeling things, you sort of tend to ignore it and not research it because it's just something happening. However, I've come to find that everything is important. And if you ignore something that's out of the ordinary, you may not be here to tell the story. And that was a hard lesson to learn. When I was diagnosed, it was very scary. I was talking to my daughter on the phone one night, and her grandfather had died. And she said, "Mom, will you stop eating chips while you're talking to me?" And I said, "I'm not eating chips, that's my breathing." So she panicked then and said, "Get to emerge right away." So there's things that happen. And you know what? When you're young and when you are reasonably healthy, you tend to ignore these little things as, "Oh, that's just me being foolish. There's nothing wrong." But it's very important. And especially today, even though for women's heart issues, I was overlooked for a period of about 5 months. Today, it's a little better, but there are still people overlooked. I know a lady that was into Emerge last year about trouble with her chest. They sent her home and she died the next day. So if you find something, you know your body, or you should know your body. If you don't know your body, you should learn your body. And when you feel something, don't give up. Keep going and keep questioning and keep making sure that you're getting the best of care. And another thing that I learned, and you see this in hospitals written up a lot today, if you haven't heard anything, that doesn't mean that no news is good news. It means that no news is no news. So if you have an appointment coming up and your doctor told you it may take 6 weeks, if you're still waiting 3 months later, check it out. If you're waiting for results of a test, don't assume because you don't hear that everything is okay. Check it out. That's the most important thing I could say. Check it out. And more, and as important, listen to those people who know just because you feel well doesn't mean you are well. When you are suffering from a chronic condition that's going to be with you forever.
Yeah. Well, you got the resource of a very smart nurse in the household that knows these things, and then mom learns from daughter after a while. But
yeah, he keeps telling me I don't listen enough, but I'm getting better.
Well, I'll tell you one thing, you're a great talker, and what you shared today was so important and so valuable. Thank you so much for taking the time to join me today and sharing such a personal story, Linda.
Well, I feel that if we don't share our personal stories, nobody will benefit. But if one person today hears this and has something that's out of the ordinary and goes and gets checked, it's worth it.
You're darn right.
Because I was trying to be checked, but I was being overlooked. But thankfully for me, I don't give up very easily.
It's excellent. Well, I'll look forward to checking in again soon. Thank you so much.
Thank you so much for having me, and good day.